LSD is good. There, I said it. Perhaps it's a little more nuanced than that, but LSD can definitely be good. But before you go on a psychedelic journey through a dimension of kaleidoscopes and goddesses, allow me to elaborate. For this video, I teamed up with Oscar Alsing, who talks about living a happier life and dating. This is part 2 of our collaboration, so make sure to head over to his channel to check out part 1 about ecstasy curing PTSD.
On the 17th of September 2013, MAP submitted their final report on LSD-assisted psychotherapy for anxiety associated with advanced stage illness. Basically, they were letting terminally ill patients trip balls. This may seem like utter madness, but as a former cancer patient Rodrigo Nino said, "My fear of dying was gone." The profundity of that statement cannot be overstated. But in an attempt to at least understand it, let me paint a picture for you. You are a young professional who had been running his own startup for 3 years after studying for the first 2 decades of his life getting a master's degree and a PhD. Besides this, you just got married and your wife is pregnant with your second child. According to society, the real life has just begun and it's good. That's it. Until you visit your doctor for that sore that's been bothering you for a while. A couple of talks and tests down the line, it appears that you have advanced skin cancer. The doctor gave you 6 more months to live. Needless to say, the horror of your impending death can produce devastating psychological damage, with severe anxiety and depression not being the least of them. Besides attempts of healing with conventional medicine, how are you going to help someone who is going to die within 6 months? Currently, psychotherapy and antidepressants drugs are used to combat the negative emotions. But with psychotherapy not yielding extraordinary results and antidepressants only being a temporal solution with a whole host of side effects who have yet to find the Holy Grail.
That is, until researchers started experimenting with psychedelic drugs to ease end-of-life anxiety. Both LSD and psilocybin, which is the active compound in magic mushrooms, have shown phenomenal results in alleviating anxiety and depression. It's debatable if this is the Holy Grail, but it is definitely holy.
Psychedelic drugs like LSD are known to induce strong mystical, spiritual and divine experiences. They can melt away your sense of self, resulting in a feeling of oneness with every person, every living thing and the entire universe. Regardless of this being real, the subjectivity felt effects are profound and I have yet to meet someone who wasn't moved deeply by a psychological substance one way or the other. This also explains why LSD-assisted psychotherapy makes sense. If you are dreadfully anxious about your looming death, it can be a real consolidation to know that you're one with everything and losing your life will only mean shredding a fabricated identity. The form of these experiences varies greatly per individual, but experience they do. In this particular study, all the patients reported lasting improvement after 12 months, with over 2/3 of rise in quality of life and 77% reduction in anxiety.
If you want to learn more about psychedelic drugs as medicine, you can read Michael Pollan's book, How to Change Your Mind. You can also help spread the word by sharing this video. If you want to learn how ecstasy can be used to treat PTSD, you can check out part 1 of this video on Oscar Alsing's channel. And don't forget to smash that subscribe button if you enjoyed this content. Stay curious.